afternoon. I am Dawn Grace Jones, and this is our Nurses Huddle for May the 8th, 2021. So today we're going to talk about, again, self-care. Because I really care for you, my colleagues, I do. And our huddle is just going to talk about this, and if you want to chime in, you can write something. I'd like to see what you write. Comment if you will, share this video, please. Happy Mother's Day. Mother's Day is actually tomorrow, and this is Mother's Day weekend for those mothers out there. As important as can be is our Nurses Week. We are coming towards the end of Nurses Week. Happy Nurses Week. We are people that give so much and care so much about everyone. Everyone we encounter, even those patients that give us a hard time because they're not nice to us, we do our best for them. That's our job, but it comes from the heart because that's who we are, right? We do it all the time for everybody, not just during Nurses Week. One thing that happens to us as nurses all the time is that we find ourselves in situations that are surreal, and they're just like, what? And we become almost over time desensitized, it appears. I can't speak for everyone, and it's not always the situation, but we seem to be able to handle things the average person can't. They can't even dream about being in the situations we're in. One thing we have to work our way to, and that is focusing on things we can control, because our jobs cause us to be often in situations we have no control over. We have to take control. We have to keep our minds strong and focused, and do our best to make the best of circumstances. And our bringing patients from wellness towards illness, wellness from illness, towards wellness on a health continuum, because health goes on and on and on. So people are generally way over on the illness end, right? Or somewhere in between, because they may not be that ill. But our job always requires us to move them towards wellness as best we can, or make them as comfortable as we can, right? So we have to focus on things in our lives as nurses generally that we can control. That would help us a lot when we talk about caring for ourselves. We have to control our emotions as we work. Our circumstances often cause us to be on emotional roller coasters, but we don't show it. We do our best, and we try to continue moving forward, but our moving forward is often with uncertainty. And I'm saying all of this because I know we all identify with the same types of situations, right? And so our anxiety a lot of times increases, but we don't show it. Because even though we're human, even though we're great and we know what we're doing and we're trained and we're awesome and this is what we love doing, we still have emotion. So all this stuff is going on in our heads. As we go on in our routine, we run into different things all the time. And all of us process these things differently. We're not all the same person, right? Some of us come from households with a lot of stress. I'm just trying to bring in a lot of the things we deal with. Some of us have roommates, families, just a lot of stress on the outside. Some of us work 2 jobs. Some of us, are struggling at work because we may be in a new area that we're trying to get acclimated to, right? All sorts of things go on with us. One of the worst things, and I read from a nurse on one of the groups, the chat groups on Facebook, about a nurse bullying her, and how we get bullied. And what do we do about that? How do we handle that? There's no one way. There's no one way. It's according to many things. And that's sad. So I can say to nurses that bully other nurses, stop it. You stop. You stop. Please stop. We have no reason to treat each other like that. And for some reason, they say we eat our young because nurses often mistreat new nurses. Not all the time. Some of us are awesome with teaching our new nurses and bringing them on board. But some of us can be just awful, making the experience horrific. I read and I hear from nurse after nurse in tears. They don't want to go back to work. They can't take it. That is just not right. You really need to think about that. I remember when I was about 22 years old, I had just come out of nursing school a little while before, shortly before that. Actually, I was 21, 22. And I had a job at one of the top 25 teaching hospitals in the United States. And there were residents all over the place, and you're learning, and their teams, and it was back when they had pagers, if anybody could remember that. And at that time, we were just starting to transition to 12-hour shifts, so that's how long ago it was. Um, so the units, the ICUs were 12 hours, but the floors were still 8 hours. And coming out of nursing school, you wouldn't dare get a job in a unit because you needed some background, some foundation, some of that before you went to the unit, the ICU. So I was on a radical surgery floor. And so our patients had all these radical procedures, and you can imagine just how intense these procedures were. And we had to get them ready pre-op, and we got them post-op, and we dealt with these patients, right? I wasn't off of probation, and every day I came to work, or most days when I was on 8-hour shifts, 3 to 11, I look at the board and I was in charge. How could this be? It was true. I was the youngest one on the floor, and for whatever reason, now I have to make the assignments before we start. I had to check the crash cart before we start, make sure it's labeled, dated, timed, or if it wasn't closed, it was changed out. I had to count the narcotics before we started. I had to do all of that. And back then, you're in charge. You take off all the orders on the floor. So for yourself, you're going to have, they had primary nursing, which at that time you had 6 patients that were your patients without a nurse's aide. They were your patients. You did everything for those patients. I'm sorry about this in my ear, guys. Sorry. You did everything for those patients, those 6 patients. Or you had 12 patients, 12 with a nurse's assistant. You never complained about this is too many patients because it was what it was, and you did a great job. And if you were in charge, you took off everybody's orders. So you tried to, if you could, not have patients, because sometimes you had to say, guys, I need you to take off your own orders, but based on your load, honestly. But you came to work and you dealt with all that. You dealt with all that. And that was my life. So we tolerate a lot of pain. We tolerate sadness. We tolerate illness, and we have to find ways of coping through all of these things, right? And these are our day-to-day challenges as nurses. So I know you can all identify with me when I ask the question, and I always came to this: how did I get here? How did I get here? How did I get where I feel like this? How did I get where I feel anxious? When we have our assignments, we go from one room to the next of different circumstances, and we handle it. Guys, feel good. This is Nurses Week. Feel good because you're awesome, not just this week, all the time, right? You may have one patient in one room who is actually transitioning, passing away, and you have to keep going in there. The family's there, and you have to keep going in there to make sure that patient's okay, and that's what's happening. Or the patient just passed away, and you're waiting for the family to come in, and you have, you know what you have to do based on the circumstances. The very next room could be a patient that's being discharged home. Discharge instructions, taking out that IV, doing everything you have to do. Family there as well, very demanding often. The next room, you may have a new admission. So you have to get that one settled in with the right attitude. Make sure you dot every I and cross every T in taking care of that new admission, right? The next room, you may have a pre-op. So you got to go through your checklist based on what procedure they're having. Do what you must do. May have to put in a Foley. May have to start another IV. All these things, you know they're coming to get that patient. Certain time, you got to have these things done. They may call early. We're coming down to get the patient. You may be in the room with the patient, discharging one patient, or the room where the patient just passed away and you're dealing with the family, or coding and dealing with that. And you may have another room with a patient that's not that stable. So you got to go in and out of that room. And that may not be all of your patients. I'm helping you right now be where I am mentally to see why I say we have to adapt, because each room could theoretically have a different emergency, definitely different circumstances. And you are that awesome that you deal with that. And these feelings don't just happen with nurses who are in the hospital or in a bedside situation. Think about the nurse manager, the stress of that. A lot of people are upset with their managers at different times for different reasons, but we don't look at things from their vantage point. But they have a whole nother list of things they have to deal with as it relates to regulatory, making sure things are in line that way, making sure they're properly staffed, making sure everything is going right quality wise on that floor, making sure you're okay and you have what you need, making sure they're doing with what upper management has commanded them to do. The hospital has said that must be done by a certain time. All of that is on their plate. And what about the nurses in academia? I now teach, and I've been teaching for a couple of years now, nursing students, graduate students, right? Who are nursing graduate students, a policy course. And I'm helping to put in place, or helping with the policy course as it relates to the undergraduate students now. And I have to tell you, I've learned so much over these years from an academic standpoint about the academic standards, the regulatory requirements as it relates to academia, and what you're trying to line up, deliver, and make sure your students get. Balancing everything, because some people think, yes, you pour it in, and you all know, we've been in school, you pour it in and you pour it on the student, and that's going to help. I'm giving them all these things to do, when in fact often you can cloud the student's mind and cause them not to take in anything. And the goal is that they learn, not that you have just given them all these things to do, but it made a difference towards the objectives. You've met them. The student was able to do these things. What about the nurse in home health? Oh my goodness. You're talking about independently. I worked home health high tech. I worked doing I administered chemotherapy in a home setting. I was a part of a wound care team. I was a home infusion specialist. I can tell you, working independently in a home health setting is awesome. I think my background as working as an ICU nurse helped me out tremendously. But I'm just saying, guys, every aspect of nursing, community health, clinic nursing, telephonic, can you imagine the energy it has to take to listen so well that you can identify enough of what's going on to say something substantial and make a difference in a patient's life? Can you imagine what it takes to do that? Every aspect of nursing is so important, and our obligation is to give quality care in all of these environments to everyone. That's our goal. And we meet that mark. That's our goal. But then when we find ourselves overwhelmed, which we all, pretty much all of us get there at some point because we are human, and we find ourselves asking that question, what about me? What about me? Yes, you may have to get professional help. I don't knock that. Professional help is awesome. At some point, all of us may need some professional help, even though some of us don't take advantage of going to a psychologist or a psychiatrist. There's nothing wrong with that. That's helpful. Remember, the person that has gotten to that point, normally, usually, if they've taken advantage of getting that type of help on that level, and that's all of us usually need it, but have really done it, they know their limits better, far better than most of us. Think about it. The person that's been burned out, that's admitted, like most of us, they have PTSD, that's gotten to that point and they said, I'm going to do something about it and get professional help. They know their limits because they've learned themselves that much, who they are and what they can tolerate. Where many of us have not had, whoever has not had the professional help that we may need, we're still trying to figure it out, right? So I say to you, sometimes, colleagues, we have to pump the brake. We have to stop this thing, stop this train. What about me? What about me? What about me? What can I do in line with a stress buster, something to decrease my stress level, something that's going to make me better? What can I do? I have to do something. I have to do something. And mom always says the first step in recovering is realizing that there is an issue. And I get in my life, and I'm not perfect, often where I realize there's an issue. Let me look at me. Let me look at me. And let me say this. Those who mistreat our colleagues, they definitely have issues they have to deal with. When you start being a bully, you have big issues because there's never a time that that's okay. You have big issues. You need to look at yourselves, right? We need to tell them that. We need to stretch more, guys. We need to stretch and walk and try to focus on other things more when we can for ourselves. What do you like? What makes you happy? What is it that makes you relaxed? What is it that works for you? How do you relax your muscles? I stretch. I'm on the elliptical 4 to 5 days a week in the morning for 30 minutes. That works for me. But somebody else may have to go walk outside. Somebody else may just have to stretch sitting down when they get a break to do that, like people in leadership that are at desk all day, right? They have those stress balls some people squeeze. They work, they help. You want to do anything you can to alleviate stress. A lot of us listen to rain sounds when we go to sleep. Alexa, play rain sounds. Say that to Alexa and see what she does. That helps us with relaxation, whether we're sleeping or not, believe it or not. Listening to the ocean, sound of the ocean. Okay, sometimes we're on the beach and we can actually hear the live, ocean. But those things are relaxing. For those of us who live in areas where we can get to a beach, walking out and looking at that beach, taking some time, oh, I'm off Sunday, I'm riding to the beach to look out at the waters, because that will relax us often. We have to stop it. We can't stay wound up, anxious, stressed out, upset, angry, working at that fast pace all the time because our bodies are not going to handle it. Sometimes aromatherapy helps, right? So when we can get that smell of something that's really good, good for us, good for our bodies, good, that's going to help us out, let's do that. Let's do that. Writing it down. I love writing. I don't have it with me right now, but yesterday someone gave me another journal. I have gifts of journals because I love writing. I write for me to me, but it's a way I get it out. Sometimes it'll end up being a poem. I write poetry, yes. I love doing that, and it's helpful for me. But sometimes you can write about circumstances or people or things that really got on your nerves, and you can keep it, you can delete it. If you write on the system, you can email it to your best friend, you can email it to yourself. You can do all of these things, which all of which help you to let it out. That's what I'm saying. All in all, we have to be mindful of what's stressing us. Some people think if they just ignore it, it's going to go away. I don't know if that ever works. Be mindful so that you can start to attack it. Remember, that's the first step. Things trickle down to our patients. When we're upset, we're stressed out, anxious, upset, mad, all of that trickles down to your patient care, and you're too good for that. You're too good for that. But it trickles down whether you think you're handling it or not. I also believe in affirmations like, I have the power to change my mind in this moment. That's an affirmation you can say all day because you can change your mind. I don't have to stay here. I don't have to stay upset. I don't have to let this person get on my nerves. I don't have to let this circumstance get to me. I don't have to allow my situation to go in this direction. I don't have to. I have choices. I can change my mind in this moment and therefore change my path, right? Whatever's affecting you. And remember, you can be excited. And people, why is she so excited? And why is he so excited? Why is this person excited when they were so upset yesterday? What happened? You realize you weren't stuck. Another affirmation. I'm excited because I am not stuck. You can do whatever you want to do, starting with your mind. The song used to say, free your mind and the rest will follow. Let me tell you, that is so true. Free your mind and watch what happens. Okay? Let it out. Talk to people like you. Talk to other nurses. You will find that most of us have been through what you're going through, or we're going through the same thing. Be it they are 21 or 71. Honestly, most nurses have the same experiences that you are having, and it's over and over again. All of us have outside issues that come into our work if we let it. All of us have work situations that can be very, very, very stressful. All of us, our work itself is stressful. No, that's not wrong. It's not that you're a bad nurse because you're stressed because of your patient load. You're human and it's okay. But what are you going to do about it? Because we love nursing. We love nursing. So what can I do as an individual? What works for me? What can I do to feel better? What can I do? Remember at the beginning, I said you want to focus on that which you can control. So you got to refocus. What can I do? If it can be done, I can do it. I can do it. You know, I'm not the only one that's stressful. If this can be done, something can be done about it, I can do it. Meaning this has happened to someone before. It's not unique to me. I'm not the only one. There are answers. I need to figure out what works for me, right? That's where we start. And you want to visualize yourself letting it go. Let it all go. Please, for heaven's sake, let it go. Remember, you are enough. As a nurse, as a professional, as a human being, as a great, great nurse, you are not enough. So if that person is putting you down, always criticizing or looking for something wrong in everything you do, that's their problem. We have to get to that point. But we need to check ourselves. Am I doing this right? Do I have my checklist okay? This is the way I've learned. I learned to do this, and I know this is proper. Does it line up with policy? Am I okay? Because if I am, it doesn't matter what they're saying, you know? And after a while, that person's going to look kind of bad if they're picking on you. It's not everybody, it's that person, okay? How am I going to handle them? Do I need to confront them and tell them to cut the crap? Do I need to do that? Is that going to start something all the time when I'm here at work that I don't want to be bothered with, but I certainly don't like feeling like this? What am I going to do about this? What's the best way? I don't know the best way for your circumstances, but I'm telling you, it starts with you. Figure it out and go for it. Relieve the stress. I care about you and I want you to understand that. So I'm a registered nurse, yes, just like you. And I've worked in many places in leadership as a risk manager. I know nursing from different standpoints very well. I know a lot about our profession. I love our profession, right? So although I have a personal injury practice, law practice, and I work as a real estate attorney, so I do title closings and stuff, and all of this is in Florida, state of Florida I cover, right? I do that stuff. I have a certain part of my practice dedicated to my colleagues. So I have nurses that get in touch with me with different issues. Many of the issues is, them telling me something and I'm telling them, just advising. A lot of times it gets a little bit into legal and I consult. That's a part of my practice, but I do consult our colleagues, right? I love doing that. I love helping us wherever I can. So what I want to say to you is I'd like you to do a couple of things. One is if you have any issues or your colleagues, any issues, you can email me at law@dawngracejones.com. Law@dawngracejones.com. Let me know what it is, small summary, and we'll talk about what we need to do next steps, right? If anything that I can do. Or I'll refer you to somebody who could help you out, right? That's a big part of my practice too. I refer our colleagues out when it's something in a certain area of law. Let me tell you what I'm talking about. The other thing you may want to do is go to my website, my legal works website, for a consultation. And that's a 30-minute free consultation, but you can line up your calendar and mine and write yourself in, and then we can meet up and you write a little bit about what's going on, and then I'll be able to consult with you. And that's law.dawngracejones.com. I hope you have those two things, my email and my website. Because sometimes we have colleagues that have something's happening and maybe a little criminal in nature. Maybe I'll refer you to a criminal attorney. Sometimes our colleagues ask me to stay on because I understand legal and medical and I can stay in the middle and be that liaison. I work like that too. Whatever it takes to help you guys out, I'm there. And I want you to know that. I also have another website. It's for us nurses and medical professionals. It's dawngracejones.com. What's there, Dawn? All sorts of stuff, information that could be useful, free information, some that costs a little bit, and that's booklets on there. But there's free information on stress busters and stuff like that that you can just get, right? And I want you to read that stuff and try to utilize it as best you can. Sign up for the newsletter. The newsletter is there. I want you to sign up for it so you can get information. These huddles are being placed on there as well. So there's information prayerfully you can use on that site. And last but not least, I want you to know my phone number. My office number is 954-628-6149. If somebody needs to contact me, contact me. I am a registered nurse. I am an attorney. I've been practicing law since 1991, and I've been a nurse since before then. And I make sure I keep both going interchangeably so I understand both well, constantly, consistently. In my job as a risk manager, I actually helped the system I was working with when new things were happening with nurse practitioners, with laws, and when they were getting more autonomy. I was the person sitting at the meetings with upper leadership talking about what the bill meant, what was coming down the pipe into law, and where we were, and how this could happen in our system. So I love policy and procedures. I love that stuff. And I want you to know I am here for you. I care about you. I care about you. So let's try to be as stress-free as we can. I come on every other Saturday at 12:30 on Facebook Live. And I think next time we'll be talking about stress again, but not all the time. But most things come back to being our best selves, right? And so we have to do what we can to relieve stress. But first, we have to identify it. You take care. Have a great day. Have a great week. Have a great life in nursing. Take care. Bye bye.